Well, good morning, and thank you for having us. As was said, the topic of our presentation will be data-led or data-driven government, in particular, how we can use the power of data science to improve public sector delivery. Just briefly about us. So we are from the Behavioural Insights Team. We originally started life in the UK Cabinet's office as one of the world's first organizations dedicated to the application of behavioral science and rigorous evaluation to public policy. So simply put, what we do is we use insights on how people think and behave to inform better policies, and then use experiments to evaluate whether it works. But more recently, we've been also focusing on data science. You go.
Great. So I think when we talk about data science, what we're usually talking about is some form of prediction or forecasting. So that might be at a kind of macro level. We might be thinking about changes to a whole population, or trying to understand an entire base of people that are using a government service, or it might be more on a micro level. So we've worked a lot to really understand particular individuals' behaviour in a lot of different government services. We can see that a lot of the initiatives for data science have been at a really local level. So a lot of the successes have been, for example, in the city of New York or Singapore, and one of the reasons for that is that a lot of government services at a local level are very integrated, and they often have very integrated data. But we are seeing the application of more national initiatives, both, as was previously discussed, sort of national AI strategies and more use within government. There's a lot of potential within quite integrated smaller countries like Slovakia for doing these kinds of initiatives, and the idea of the data lab is particularly interesting there because it allows government departments potentially to use each other's data, which has been a big problem with what we've been working with in the UK, where that's not necessarily present. And some brief discussion of what our experience is. We've worked a lot with the UK Cabinet Office to pilot a lot of ideas, which will be published next year online as a way to encourage government departments to do more data science. We've done, in particular, a lot of work in social care. So this is trying to identify adults with complex needs who might need support early, or who might become very high-cost cases. In particular, in a lot of Western countries, there's a lot of potential there, I think, where adult social care is becoming increasingly expensive. We've also looked at things like people who go to accident and emergency wards who don't need to be there. That's what the 111 is basically. If you don't have an emergency but you need some health advice in the UK, you can call this service. Some people are told that they don't need to go to hospital but do anyway, and why they do that. And we've also worked a lot with the private sector to look at the determinants of gender pay gaps and ways to identify problems that occur with people's labour market policies in advance. So that's the kind of things we've been working on. I'll talk through some particular examples now. I think in terms of the major applications of data science, we can sort of see 4 of them. One is the ability to plan services, so that's forecasting use of them, but maybe also targeting services a bit better. And that relates to the second thing of trying to target services at the individuals that will be able to make best use of them, and identifying vulnerable consumers in advance. The third area is on improving decision-making. So what we mean by that is that decision-making by civil servants could either be inaccurate, either making a wrong decision in advance, or it could also be biased. It could be incorrect against particular groups, for example, ethnic minority groups. And we've worked with, for example, the UK Home Office, which is in charge of immigration policy, to try and study the decisions that the immigration decision makers make, and to try and study whether basically we can make them more accurate or less biased. And lastly, in terms of evaluating government programs. So I'll quickly go through all 4 of them now. The first idea that I want to talk about is the idea of targeting inspections. So we've worked with a lot of inspectorates in the UK to better target their regulatory activity. And what we mean by that is trying to identify schools that are at high risk of failing their inspection, because there's some problems with the teaching, for example, in advance. And what we found is that based on the data we can collect, we could only do 10% of as many inspections and still catch 60% of the inadequate or high schools. And given that we can't re-inspect every school every year, this is important to try and catch scores before they're failing. We found that a lot of this has to do with, so the bar chart on the right is sort of the percentage of the overall accuracy, what's determining it, and it's a bit hard to read, but basically the main determinants are exam scores, so that's what is key stage performance there. Determinants to do with the workforce, so that's, for example, about teacher turnover, and census characteristics of the local area. So what kind of area we're talking about here. So this could be a quite useful thing for a lot of government regulators to identify in advance what institutions are likely to have failing performance. The second sort of application is targeting service provision. So here what we were trying to do is find people who are likely to be problem gamblers. The idea there is that gambling operators might be able to tell people that to exclude people from platforms, or to give people support if they're using a platform too often to gamble. And what we did there is that we collected a bunch of surveys on people and how gambling was affecting their lives and could judge whether they were problem gamblers, and compared that to information we got from companies about their behavior within gambling platforms. And what we found, again, if we look at this percentage of the importance, is that the main determinant was stakes. So that means just the amount that people were betting and the pattern in which they were betting it. And smaller determinants were things like demographic factors, so gender and age, for instance. But this is a way of trying to find vulnerable consumers, which is quite important as well. The third thing I talked about was improving decision making. So this isn't work by us, but it's work by some American academics. And what they were looking at is whether you could improve judicial decision making as to who to release when you go through initial court proceedings. So whether someone should be out on bail, whether they should be released to the public or not. And what they found is that basically you could either, for the same level of crime, release more defendants, or decrease crime and release the same number of defendants. And that was because some judges are particularly harsh and they're not making correct decisions. So what they were able to do is use information to look at who is at risk of committing crime in the future, which was the only reason which people shouldn't be released in the state that it was in. And we think that there's quite a lot of potential here to audit the decision-making of public bodies. Finally, the last thing that we do a lot of work with is evaluating government programs. So the idea of this particular method is that you compare a state or a country compared to what would have happened were the policy not implemented. So here, for example, the academics compared California with a synthetic or artificial version of California if cigarette taxes weren't implemented, and looked at what the effect of cigarette taxes was on reducing pack sales. So the way that they do that is that California is somewhat similar to other American states, and so they use those states to predict what would have happened if the policy was not implemented, which did not raise cigarette taxes at the same time. So in a similar way, you could think of comparing Slovakia to other small European countries in order to be able to evaluate government programs. And this is particularly good if you can't do an experiment, so you can't raise cigarette taxes very easily in certain parts of the country or only on certain individuals. It's much easier to just raise it in the whole country, but you still want to be able to say something about the effectiveness of government programs. So this has also been an area where we've been doing lots of work. And finally, I just wanted to say something a little bit about the challenges. Firstly, a big challenge is producing good data infrastructure. So can't do data science projects unless civil servants or other people they're working with can access the data. Secondly, skills. So it's not just about developing technical skills so that people can do the analysis, but also so they can implement it in practice. Because as the Minister was talking about, there's no point if you can't actually implement these things in the actual day-to-day delivery of services. The third challenge is the GDPR. So there's both issues around data sharing, but there are particular rights that the GDPR gives people against having decisions made about them in an automatic way. So those are things that government bodies need to take account of if they are to use data science in practice. The last problem is that you can produce bias because the data that it was constructed off was already biased. So in the United States in particular, there are really large issues with criminal justice data and ethnicity because police are arresting more African-American people. And so if you construct an algorithm, it artificially identifies African-American people at higher levels of risk, even when they are actually objectively not. So that is still an issue in European countries to an extent, where there's still some bias against ethnic minorities. So that can be a kind of a problem. But we just wanted to make sort of clear what some of the challenges are.
And so now quickly, as we heard about the potential of these predictive models, I guess the question is, how could we then embed these into the daily practice of public sector? And so very quickly, we have essentially 3 examples here, starting with decision aids. So we know these aids which are essentially used to help professionals make more accurate decisions more quickly. Normally, these would be based on some kind of best recommended practice or professionals' expertise, but what we can do is we can use data science and insights from that historical analysis of big data to improve on these aids. So for instance, in this case, researchers predicted the likelihood of stroke in hypertensive patients and then distilled that knowledge into a simple aid that can be then used in a daily practice by clinicians. And obviously this is something that could be used across frontline public sector services. Another example are case management systems. So again, these are shared databases that we already have in some cases that compile all the information relevant to a particular case, let's say a patient case or a student's case, and that help us visualize and monitor the progress of that case over time. Well, data science can help us in 2 ways here. First, to flag cases which are at potential risk of becoming problematic, and then second, they can help us suggest preventative action that is appropriate to address that type of problem. So for instance, these types of systems are used in schools to help pick up students which have maybe dropped a class for a certain number of times, and then to suggest action, specific action to teacher that they can take on to address it. And lastly, and this is at a higher level of decision making, we can use data dashboards, which, as we know, are used to collect information from different sources to help us visualize information in a single place and hence improve decision making, because we suddenly can observe both past trends and future tendencies. Now, this is something that can be used internally across government to monitor internal KPIs, but that can be also used to inform future policy making in terms of, for instance, optimization of public service provision. So let's say, based on the number of patients or students that we see, how many more teachers or doctors do we need in particular area in the future? And lastly, in some countries, such as Canada, or in this example in the UK, countries are now experimenting with making these data dashboards relevant to a particular policy area public, so that it becomes more obvious what the government is actually delivering for people, hopefully hence improving their satisfaction. So these were but a few examples of the kinds of things that a data-led government would be doing. Ultimately, the vision really is for these insights to be used comprehensively across different areas and across the whole pathway, as in this example of data-enabled healthcare, where really the idea is we can use data science to be able to better predict needs and hence allocate resources more appropriately to improve productivity, but also fundamentally to improve the very content of the service that we are providing to citizens, as in this example by providing more personalized and targeted diagnosis and treatment, so that ultimately we are improving people's experience and their outcomes as well as their satisfaction with public sector. So thank you very much, and if you have any more questions, please let us know. Thank you.